Thank you for joining me, Dr. Ocean. So my first question for you is, what do we know about COVID-19?
We know that patients who have cancer are at particularly higher risk of developing contracting COVID, and they're at higher risk of also getting sicker with COVID because of their compromised immune systems. Not every patient with cancer has a compromised immune system, but on the whole, patients who are certainly undergoing chemotherapy or if they're on immunotherapy or if they've had a transplant, those are the patients with cancer that are the highest risk for contracting COVID and also for complications related to COVID.
Sure. Now, what is being done to reduce the risk of the virus to patients with cancer, especially in New York, which has the highest number of cases in the United States?
Yeah, these are really challenging and scary times for patients who are dealing with cancer because they have another battle to fight in terms of trying to avoid COVID. And what we're doing for our patients is we are trying to figure out who is at the most risk. And if they are at the most risk, then we're trying to modify their treatment regimens in a way that will minimize their exposure. By that, I mean minimize them coming into the medical facility, having to travel, having to take transportation, et cetera, minimizing all those patient encounters where they could potentially get exposed to the virus. So for some patients who are on chemotherapy, for instance, every couple weeks they come in, we would potentially sometimes increase that interval in between treatments to every 3 weeks. I have changed certain patients who are eligible to oral chemotherapy rather than coming in to get IV chemotherapy. We just make sure that they're protecting themselves and social distancing and really washing their hands frequently, wearing a mask when they go out, and at all times, mask and gloves. Actually, I tell my patients to wear both, and just really just stay inside as long as they can and as much as they can. And for the most part, all my patients, they tell me they haven't been outside in 5 weeks, which is great because that's how they're not going to get sick. If they don't come into contact with the virus, they are not going to get the virus. And that's really the key point. One of my friends described this virus very well, and I think it's a perfect analogy. The virus is like glitter. I know when my kid plays with glitter, it's everywhere. And little sparkles everywhere. And that's like, think of the virus particles as glitter particles. They're everywhere. If you go outside, you don't know where that glitter is. So you have a much more of a chance of contracting the virus.
It's a great point. Sometimes I'll see glitter on my hands that I don't even know where it came from. So it's a great analogy.
Right.
So then could you elaborate a little bit more on how your institution has responded to the pandemic?
Well, I am so fortunate that my hospital is at the epicenter and is doing an amazing job of protecting the staff, the patients, the workers in the hospital, everybody. They are, I mean, I'm not surprised. It's considered one of the best hospitals in the nation for a reason. We are well equipped to handle all of these problems related to COVID and even non-COVID issues, like patients that are coming in for other reasons too. That's the hard part about all this is in the time of COVID, people that have other conditions like heart disease or lung disease or kidney disease or a motor vehicle accident or something like that, they have to get taken care of as well. And so we have to have all teams prepared, COVID related treatment and non-COVID related treatment. And I really think our institution has done an excellent job to make sure that we're containing it and treating the patients very effectively. This is a really, really hard time, and our staff is working nonstop on the front lines, exposing themselves, risking their own lives to take care of everybody. And they do it with such care. And I know that because I know my colleagues who are doing it. I've been at this hospital for 20 years, and I know that these people are the family of these patients when there's no family there, and they're treating them like their own family members. And that just warms my heart, because that's the only good in this situation right now for these very, very sick patients that are in the hospital.
Sure. Now, have you or a colleague treated a patient with COVID-19? And if so, how did you approach treatment?
So my experience with a patient who had COVID was very upsetting and challenging. I didn't even know about it. So what happened was, I saw a gentleman who was about to turn 65 for a completion visit after chemotherapy. He had just finished 6 months of chemotherapy for stage 3 colon cancer. And I saw him at the end of February. I think it was like the 25th of February. And we talked about what he has to do to keep the cancer away, and how he has to eat well and exercise and not eat too much red meat, and make sure his vitamin D is okay, and eat nuts, and all these lifestyle changes we're talking about, what we have to do, what he has to do to increase his chance of cure with colon cancer. And he told me he was looking forward to his 65th birthday, and he was going to have a big party and celebrate the fact that he was done with chemotherapy. And it was a really, really special visit, and we hugged. And at that time, I really wasn't wearing PPE. Like we kind of didn't know how bad this was going to get then. And I hugged him, and and then a few weeks later, his wife let us know that a couple days before she had called us, that he had gone to a hospital, an outside hospital, with cough and shortness of breath, and had a extreme worsening of his condition within 24 hours and passed away. And the day that he was admitted was on his 65th birthday. And I was so upset, because all I could think about was how much he was looking forward to living again, and to living well again, and just, it was such a tragedy. It's a tragedy for everybody that is taken from this virus. But that was my experience with a patient actually presumed to have it. We actually don't know that he had it, because the testing it was too fast. It all happened too fast. And I know he was tested, but it was presumed to be a death related to COVID complications. And anyway, it was really, really sad. I'm lucky, though, that I didn't have essentially an exposure to him, because it was many, many weeks later, and I've been asymptomatic and haven't had any symptoms whatsoever. And since then, since the beginning of March, we've been wearing PPE in our office. I use a N95 mask. I use a surgical mask on top of it. I use gloves, and for every patient I see. So I haven't had any exposures other than that story of my patient who passed away.
I'm sorry to hear that, but
Thank you.
a testament to the severity of the virus, truly.
Exactly. Right. And that's really there's so much we don't know about this. It can manifest in different ways. What's very interesting, and what just came out yesterday in the Lancet, what an important research paper from researchers at Weill Cornell, showing that the virus works by activating the complement pathway, and that pathway is in our immune system that triggers the immune system, and it's also the pathway that deals with clotting. And when complement gets activated in our bodies, it leads to small vessels forming blood clots, and these are called microthrombi. And these researchers found out that, unfortunately, when these patients from COVID passed away, they did autopsies and biopsies on the patients, and found that it wasn't causing the problems in the lungs that we thought COVID was causing. Previously, it was thought that these patients were experiencing what we call ARDS, which is lung failure, basically. But it turns out that the failure of the lungs was not due to ARDS. It was actually due to these microthrombi that are overwhelming the lungs and causing the patient not to be able to breathe. And this is very interesting and important data that is coming out, because hopefully that'll lead to better treatments for it, such as anticoagulation or other treatments. But right now, we know that this virus triggers the immune system, it triggers the complement system, and it causes a microthrombi process throughout the body that can affect many, many organs.
Sure. Now, there's a lot of information out there, a lot of things that we don't know, a lot of misinformation. So you're big on social media. How are you using that platform to obtain and share experiences as it relates to COVID-19?
Well, I am glad that I have a voice in that world, because we really need to make sure that people know what is correct and what is not correct, and what's the best way that they can protect themselves from the virus. And what I've been doing is on Twitter is retweeting important articles. I was asked to write a piece for Katie Couric about how the pandemic has affected cancer patients, and that was published on Medium, which is a big outlet. So that was great, and we get to put our voice out there that way. I'd love to tell you about a campaign that I helped to create, which is just taking off now. I have a friend who is the CEO of a basketball media company, content company that profile players off the court, NBA players. It's called Close Up 360. And I partnered with him to create a campaign called Hoopers Meets Heroes. And what we're doing is we're pairing NBA players in each of the 30 cities where there are teams with a frontline healthcare worker to interview them about their experiences on the front line, what they're seeing in their own city, what messages they want to get across to the people. We're trying to target a younger demographic, and it's really, really taken off. It's been wonderful. We've done about 10 interviews so far, and I'm tweeting those, and putting them on Instagram and getting the word out with that. So that is something that I'm doing in the social media realm to raise awareness. And what's also great is that through this campaign, this Hoopers Meets Heroes campaign, we've partnered with getusppe.org. And that's an amazing grassroots organization started by emergency room physicians, which is like a clearinghouse for PPE. So there's at least 1,800 institutions that can register with this now nonprofit organization if they need PPE, if they have PPE to donate, and they match the needs with their donations, and so that they can coordinate all this PPE all across America. And it's really a wonderful organization. And in creating this campaign, we wanted to make sure that people knew about this ppe.org, could donate to it, and so that they are one of our partners in this campaign.
That's wonderful. All great initiatives.
Thank you.
So, is what can be done? Is people else? What are you recommending?
So there are many places that have shortages. That's very true. In the beginning of this, I know I'm going to need PPE. We don't really have enough N95. Physicians, you're not healthcare workers. Could you send them to me? And I got so many friends donated masks and sent them to me into the hospital, and we've used them to see and not the official 3M type, etc. And they that's been wonderful. You're not supposed to reuse N95 masks because it's supposed to be patient by patient basis, and you have to assume that everyone has been exposed in a way. Like, remember the glitter thing? So, so you have to assume that everyone's been exposed. So you're supposed to throw away a mask with each patient use. We don't have enough masks to do that for every patient encounter. Unfortunately, they do that in the hospital for sure, but we do not have enough masks as in the outpatient clinic for that. So what I've been doing is wearing the N95 mask with a surgical mask on top. And if that surgical mask, and I try to change it every couple days, that I'm seeing patients. We really do a great job of screening patients before they even come in to make sure that they don't have symptoms. We check their temperature the second they get off the elevator. We, grill them about their symptoms and make sure that they don't have anything. And our patients are really, really behaving themselves, and they don't want to get it. So they're staying inside and doing a great job with social distancing. So I really don't feel that I'm at a huge risk when I'm seeing my patients day to day because of the PPE that I have.
Sure. So we've talked a lot about prevention and protection, but what about treatment?
This is the hardest part because patients are scared that their cancer is going to get worse during this time of the crisis. I'm scared that they're going to get COVID and die of COVID. And for the most part, most of my patients are not at immediate risk of dying of COVID if they get it. And that's a discussion I have to have. We do so many video visits now. And I kind of negotiate with them. I say, listen to me. I feel like this is not in your best interest to come in this time for chemotherapy. Usually I'm having this discussion with the older patients. Stable on, weekly or every other weekly chemotherapy when their cancer is completely stable, if not, in remission, and it's time to take a little break from the treatment and have them not come in. So I have these dialogues all the time with my patients, trying to console them and say, it's going to be okay. It's going to be okay. But unfortunately, they're so scared, and rightfully so. We just don't know. One thing that is really good that we're doing, and I think a lot of centers are doing, is actually collecting the data about the changes that we're making to patients' regimens so that we can know how these changes impact their outcomes, that's going to happen, because so many people are having their regimens changed or having their regimens, fiddled with so that they can, get through this crisis. But we know that it's going to affect outcome in some way. We just don't know how significantly. And so we are collecting that data and hopefully going to eventually publish that data when we get more of it to show, this is the impact that these changes, unfortunately or fortunately, have had, to show that these breaks from chemo really didn't affect patients so negatively as we are thinking that it, that would be wonderful news. So we want to report how these changes are impacting patients everywhere. And so there's large databases of that we're trying to collect information about affecting patient outcomes.
Sure. Now, in that interim, are there certain therapies that you should try to be avoiding?
You mean cancer therapies? So it's more, we have to take it a patient by patient basis. There are some patients that I don't want to give chemo to because of, like I said, they're elderly and their cancer is stable. There are other patients where they need treatment because they're sick and symptomatic from it. And so I would kind of just get them through it and treat them kind of the same way as before, and just really hope that they don't contract time. It do and what not to do.
Sure. Now, there's a lot of research being done to develop a treatment for COVID-19, potentially a vaccine. Could you shed any insight on that, the work that's being done in that regard?
It's going on, I think, over 300 trials on non-vaccine treatments alone. There are probably many more with vaccines and groups working on vaccines. Um, I think that's going to be the answer to getting us back to normalcy here, is having a definitive treatment or a vaccine for COVID-19. I'm not really too familiar with all the vaccine efforts, honestly, but I know that there's amazing researchers working on them internationally on this effort. In terms of other treatments, I know that many patients who are in the ICU and are really symptomatic and have severe COVID symptomatology, different hospitals are using these immunosuppressive agents and complement, IL interleukin inhibitors, things like that. There are trials going on with remdesivir. There are trials going on with hydroxychloroquine and azithromycin. We don't have any solid data yet about the usefulness of these medications in COVID. Certainly, there are people that have been helped by these medications, but in order for us to recommend them across the board, we need more data. My personal feeling is that hydroxychloroquine is probably more useful as an agent earlier in the illness rather than when someone is so sick from it. That's just my, I don't know. I'm just, in hearing the stories and seeing the patients who have been on it, or hearing their stories, I just think that it's more helpful earlier on, or could be more helpful earlier on. I haven't prescribed it for anybody, and I wouldn't do that until we knew that there was more evidence in terms of even a prevention for it. There are other measures that pulmonologists and from the ICU critical care anesthesiologists about proning patients, like putting them face down. They oxygenate better that way. I was like, I remember learning that a little bit from medical school, but not, it's been a long time since I've worked a ventilator and done that. So, there are other ways that our frontline docs are helping patients with COVID other than medications.
Sure. Now, you mentioned telemedicine earlier on. You're doing more video visits with your patients. Do you think that it's going to retain its role following the pandemic?
I absolutely think it's going to retain its role. I think that it should have been probably involved and been more used previously than it ever was before. Interestingly, we can now bill for video visits, whereas before physicians even could not bill for phone calls or log that in as an individual healthcare visit, but now we can. And I think that it one hand, sometimes it's a pain because the patients, especially some of the older patients, don't have the access to the internet or the computer, or they're not savvy with the log on information or whatever. But most people figure it out and can do it. And I'm, I've set up a lot of video visits throughout the day. I joke with some of them if they run over time because of these technical difficulties. I joke with the next person. I say, yeah, just like in person, I'm running late. And so even on video visits, I run late because I like to take a lot of time with everybody. But some of that time now is getting the system to work. But for the most part, I think all of my colleagues have it down now. It's going to be the future for sure.
Sure. Now, thinking about the future, it's an interesting point. Um, I wanted to ask, do you think there should be a national license for healthcare professionals, given that so many people are kind of scrambling and, to reroute care to those hotspot areas?
Absolutely. I think that it can only mean good things if we had a system like that. I am so appreciative of all of these healthcare workers that are being brought into New York City to help in the crisis. And what is upsetting to hear that there could be more if they didn't have to go through a strong credentialing process to get here. These are healthcare workers that are working wherever they are, and they're verified, they're true, they're real strong providers, and we should just be able to say go to it and practice in our ER like it's their own ER. That doesn't happen so smoothly, and I understand that there are reasons why we have to verify and make sure that people are legitimate and qualified to enter the hospital, so that they're not licensed in. I think it should definitely be a mandatory thing that we have a national license. I think this pandemic is teaching us a lot about the future.
For sure. So then what is the biggest challenge you're facing in practice? And I guess, what is your advice to colleagues who may be facing similar challenges?
My challenge is really trying to cope with the emotional uh, um, hardness and the emotional problems that patients are experiencing right now because of their fear of their cancer, and how to help them get through this very stressful, scary time. For me, that's really the hardest part right now. um, and also not being able to comfort people, by touching them and hugging them and face to face. And I mean, we can be face to face video, but it's just not the same, and it's colder, and it's just people want to, um they want that interaction, and we don't have that. And it's really, really sad for me to see all these people's family members in the hospital alone, without anybody to that of their own family to take care of them. Thank God we have wonderful providers all over that are taking care of these sick patients, but it's heartbreaking to see these stories of people dying of COVID in hospitals, and they can't say goodbye to their loved ones. It's heartbreaking. So to me, the emotional, uh, the emotional issues are the most challenging to deal with. In terms of my other colleagues, I think they would probably say the same. I think they're scared also, especially the ones on the front lines, of bringing it home to their family, maybe bringing it home to some of these people live with their parents, and maybe their parents are elderly and they're going to bring it home to them. They have to be, or some of them have to be separated from their family while they're on the front lines for months at a time. And that's really, really challenging. And not to be able to, it's just such a disruption of our normal lives, and we really need to figure out a way to work through these stressful times with self-care, like if it's exercise, if it's journaling, if it's meeting with a counselor, if it's having a Zoom dance party with your friends, whatever it is. Just do something to help to get out, to release that stress, because we're all dealing with such heavy stress and uncertainty in this situation now, and it's really hard. But I think that our we are trained as healthcare providers to delve into these hardest issues, and we know how to find resources to make people better. So I think that we have to take our own medicine and really take care of ourselves so that we can take care of the patients.
Sure. And then hopefully end up on an upward trajectory. So my
Definitely.
question, is there anything else that you wanted to emphasize as it relates to COVID-19 and oncology?
Uh, I just want to tell people to keep on doing what they're doing in terms of social distancing. Really don't go out if you don't have to. There are so many do-gooders that are willing to buy groceries for you, to deliver things for you. Just call companies that have like Fresh Direct or food delivery companies. I bet that they would get someone who's dealing with cancer a delivery time, because I heard that it's very hard to get a delivery time for groceries now because they're all being, but if I told one of my patients, I said he was complaining that he can't get his food delivered. And I said, well, call them and just tell them what you're dealing with. I'm sure they're going to give you a time. And they did. And so, I feel that we really have to stay home, social distance. We're going to get through this. It looks like things are already starting to improve, that we're flattening the curve effectively because we are staying home, at least in New York. And, this is a horrific, horrific time with so much sadness. But as long as you stay home and practice social distancing, things will get better.
Well said. Well, I appreciate your time and speaking with me today, Dr. Ocean.
Thank you so much for having me. Stay safe.
You too as well. Bye.
Bye-bye.